Welcome back to Identity Stack. This is Dr. Sara Austin, Content Lead at Key Data Cyber. Today I'm joined by Arun Shrestha, Managing Director at BeyondID, to talk about how AI is changing identity security in healthcare and what organizations should be thinking about. Arun, thank you for joining us.
Thanks, Sarah. Great to be here. It's an exciting time in healthcare security because identity is becoming the center of how organizations protect system data and patient care.
So before we dive in, can you tell our listeners a little about your background in identity and cybersecurity?
Absolutely. I've spent about 2 decades working in identity access management space, working for organizations like Sun Microsystem, Oracle, Okta, most recently a company established called BeyondID. And the focus has been helping organizations modernize how they manage and secure identities across their environment. So particularly for the topic of interest today, as we're having this conversation, healthcare has always been particularly very interesting because of the fact that identity directly affects patient care, clinicians needing fast and reliable access to systems, but organizations also have to meet strict security and compliance requirement. And so today my focus, my work, especially what I believe in and my passion and focus on helping organizations to secure both human identities like clinicians and staff, but also non-human identities such as applications, APIs, and now increasingly AI agents.
So AI was a big topic this year at HIMSS. How is AI changing identity security?
Another great question. Let's start with the really interesting statistics. 40% of healthcare employees report using AI tools that are not officially approved by their organization. That means it's creating a significant unmanaged identity risk. And this is a report created by Salesforce back in 2024. And that number probably has gone up even more than 40% now. So what is happening? AI is introducing a category of identity risk that most healthcare organizations are completely unprepared for. Beyond human users, organizations now have AI agents, automation tools, service accounts, and machine identities interacting with many sensitive systems around the clock. These non-human identities can query electronic health records or EHR systems, triggering orders, accessing protected health information, often without any people in the loop. The problem, in my opinion, is structural. Most identity programs were built for people. They were designed to provision a nurse, grant access to EHR system like Epic, and offboard a contractor. They were never designed to govern an AI agent that autonomously access 10 systems simultaneously, or a shadow AI tool that department had installed without IT's knowledge. Essentially, shadow IT is transitioning to shadow AI. Shadow AI is particularly dangerous when clinicians or clinical teams adopt AI tools outside of a formal procurement process. Those tools often operate with excessive privileges and no audit trails. So that means an attacker's ideal entry point is what it becomes. Identity programs need to evolve urgently to govern both humans and machine identities, including AI agents with equal rigor.
That's a great segue for what we will be talking about today, actually. As you know, healthcare organizations today do invest heavily in cybersecurity. So why is identity still such a big challenge?
Great question. It's because the environment is fundamentally different from any other industry, and attackers know it. So let's take, for example, a typical health system has tens of thousands of identities in motion at any given point. That includes physicians, nurses, residents, contractors, vendors, remote staff, and an expanding ecosystem of connected devices and applications. Many of these organizations have accumulated identity systems over decades through mergers and acquisitions. So they are essentially fragmented, they're poorly integrated, and often managed manually. The result is a landscape where visibility is limited and access is inconsistently controlled. Let me just share a couple of stats. So if I look through the overall report produced by Verizon, 82% of healthcare breaches involves a compromised identity. Essentially, a credential stolen, the accounts left active after staff departing, or, for instance, excessive privilege exploited. The other interesting stats and very mind-boggling to me is the average cost of healthcare data breach. That's close to $11 million, the highest of any industry for the 13th consecutive years. That is based on IBM's report that was produced a couple of years back. So essentially, attackers don't break in anymore. They just log in. And shadow AI also simply log in. And in healthcare, where legacy systems may not support modern authentication standards, and clinicians are also sharing workstations and credentials under time pressure, the door is often left open. So essentially what I'm saying is strengthening identity security is really about making sure the right people and the systems have the right access at the right time without slowing down the care being delivered.
So can AI actually help improve identity security, or does it just create more risk?
Another great question. The simple answer is both, which is why governance has to come first. But when AI is applied correctly to identity security, results are significant. Traditional access monitoring relies on rules and thresholds. A user who does something slightly unusual might never trigger an alert. AI changes that by establishing dynamic behavioral baselines for every user and every application. That means surfacing deviation in near real time. So practically speaking, this means the system can flag a case where a hospitalist is accessing oncology records they've never touched, or a service account querying a database at 2 in the morning at 10 times its usual volume. Those patterns are nearly invisible to human reviewers. However, the good news is AI can catch them. AI is also transformative in terms of the lifecycle management. One of the healthcare most privileged or persistent challenges that we are aware of. And considering the operational reality, for instance, you have examples like health system may onboard hundreds of residents, fellows, and traveling nurses every 90 days. Contractor accessing is often provisioned manually or rarely reviewed. Another example is a staff who leaves or change roles frequently, retaining the same level of access they no longer need, a condition known as privilege creep or standing privilege. So what's to rescue? Automation eliminating the manual bottlenecks in this cycle. And access is granted when a role is assigned and revoked the moment it ends. It's not weeks later when someone remembers to file a ticket. So you don't have human remembering it, but you can automate that through AI. So now in this case, AI helps identity teams move from being very reactive in terms of their security and responding to breaches after the fact, to being very proactive in governing and the governance that prevents them from happening in this first place.
We know that clinicians operate under intense time pressure. So how do you balance real security with practical workflows?
Excellent question. The answer is tied to what the first responders, in this case the clinicians, are doing. They are dealing with life and death situation. And the challenge is that the defining tension in healthcare security, getting it wrong in either direction has real consequences. On one hand, you're looking for speed. On the other hand, you're looking to ensure that whatever is being done is a good action that results in the life of the patients that the clinicians are dealing with. So in other words, if the security is adding too much friction, examples like extra logins and timeouts and repeated authentication steps, clinicians work around it, but they don't have a choice. What they do, they share passwords, they stay logged in, they use personal devices. You now have made the organization less secure in the name of security because the clinicians are going around all the systems and the guardrails. So the real answer, the right answer is the context-aware adaptive authentication. In other words, what we're saying is security is there, but you never feel it. And it's only time you feel it is because it's needed. The system evaluating the risk level of each access attempting based on multiple logins or signals like device trust, network location, time of day, role, and last but not least, behavior pattern. A physician logging in from a trusted workstation inside the hospital on a recognized device should have a seamless experience. That means it's a secure and it's a known situation. Whereas the same credentials coming from an unknown location at an unusual hour should trigger additional verification. So here are some of the things that require what we call healthcare specific workflows. And there are specific solutions we recommend. So for instance, shared workstation. It's common in nursing units. So batch tap or proximity-based fast user switching allows secure rapid authentication without password entry. So something the clinician has access to that can only belong to that person. The other example is break glass access, and it's a life and death situation, emergency scenarios that require immediate access to records without a clinician's normal scope. These should be provisioned instantly, logged completely, and reviewed automatically, right? So that they're not waiting to someone to help them log in. The break glass access is really important area of how it's done properly. The role-based emergency access. When a patient is transferred to a different unit, the treating team needs seamless access. Identity system should follow the patient, not create a ticket. Last thing I'll talk about here is the HIPAA requiring audit logs for PHI access, all PHI access. So the well-implemented identity security doesn't just satisfy that requirement, but it also makes them compliant, and compliant largely automatic.
So for organizations that are thinking about modernizing identity, what should they prioritize first?
Yes, it's good news is it's a very solvable problem or challenge. And the first and foremost, let's talk about the difficulty, right? So then we'll talk about how we can tackle that. So most healthcare organizations are dealing with 20 or 30-year-old EHR systems that weren't built for modern identity integration. The fragmented directories across merged health systems and limited IT resources. These are common challenges. So modernizing identity is a multi-year effort, not a simple deployment. And that's the mindset you have to have, is that this is an ongoing modernization effort and the organization has to be committed for a long haul. That said, there's a clear framework we have seen that help organizations make meaningful progress without trying to boil the ocean. It's going to be overwhelming otherwise, right? So what we call the framework includes 4 verbs, that is discovery or discover, onboard, protect, and govern. And it applies to every identity type, whether it's human, non-human, and AI. So let me walk you through each one of them. First is discover. Essentially, you cannot protect what you cannot see. Begin with a comprehensive inventory of every identity in your environment: human users, service accounts and AI agents, vendor integration, and legacy system accounts. Most organizations discover that they have 2 or 3 times more identities than they expect. Pay particular attention to shadow AI and unmanaged machine identities. These are your highest risk blind spots. Second, onboard. Modernize your joiner, mover, leaver processes. Access should be provisioned automatically when someone joins or changes roles, and revoked immediately when they leave or transfer. Every identity, including AI agents and automation tools, should have a named human owner who is accountable for its access. In other words, human in the loop. And legacy manual provision creates the exact gap attacks or exploits. So what we want to make sure is that there's always human involved, even in the effort to onboard using the AI for the AI agents. The third step or third part of the framework is protect. So apply least privilege and just-in-time access across the board. No more standing privilege, no more the privileged access that never gets canceled. No user or system should have standing access to more than they currently need. Privileged access to EHRs, admin systems, and patient data repositories. All these systems, the systems should be granted access to these end users only for specific tasks and automatically expires once the task is done. Implement continuous monitoring that revoke access instantly if anomalous behavior is detected. And any funny behavior you detect, you should be able to remove that access instantaneously. The last phase is govern, or last step. So access reviews should be fully automated, right? So it should not be once a year or once a few months. It should be fully automated. It should be risk prioritized, and it needs to be continuous, not as I said, non-annual checkbox exercises. And oftentimes that's what happens when it comes to governance and certification. And so essentially certifying access based on current role and actual usage patterns. Extend governance to AI agents with the same rigor applied like it is with human users. That means logging every action, reviewing every access grant, maintaining a complete audit trail for HIPAA compliance and OCR investigations. So essentially, if you go back to these 4 steps of discover, onboard, and protect, and govern, you do that in a ongoing cycle, in a loop. What that means is the organization, these organizations are treating identity as a strategic security layer, not just an IT function. And these are also the organizations that are better protected, more compliant, and better positioned to adopt AI safely. Essentially, identity done well doesn't just reduce breach risk, it is also great for supporting better healthcare delivery. So if you do one thing this year, essentially what I would say is get full visibility into every identity in your environment. You can't govern what you can't see, and what you can see is exactly what attackers are looking for.
Arun, thank you so much for sharing your expertise and insights about how AI creates new risks and opportunities for healthcare organizations. And to our listeners, if you want to learn more about how you can defend your organization against AI threats, be sure to visit us at BeyondID.com, where you can schedule a complimentary workshop to assess your security needs and receive a blueprint to a secure, scalable IAM strategy for your organization.